Thank you. We just want to open the floor. 2 questions that we can take concurrently, then we can be able to proceed. Do we have any questions in regards to his presentation? Just raise up your hand wherever you are. To you. Okay, fantastic. Let's appreciate Moses with a round of applause one more time. Thank you for that, and thank you for your fantastic presentation. Great. To give a warm high five here, ladies and gentlemen. At this particular point in time, I would like to call upon the next speaker, who is going to be representing Dr. Abdi Gedi, the Managing Director. But before we smart offers, which ones would you be interested in? Smart Health, Smart Analytics, T&A, include your contact details. Please, if you can be able to match in Dadaab, Garissa County. Betha, let's appreciate Max.
Platform integrates easily invoice processing and also
well known in this region. Wale wabaya wow. Okay, let me see how many of us, and I know we're in Mount Kenya. All right, but just look to this side and to this side. Like you're looking at your shoe, pull it just like this, to the side, to the side, to the side, to the side, and to the side. Now I want you to fold your hands like this. And then I want you to turn to this side. And then I want you to tap your foot here like this, like that on this side. And then I want you to switch to this side and tap your foot like this, like this, like this. Turn to this side like that, turn to the other side like that, like that. And then I want you to do one thing. You'll clap down and pump it, pump it, pump it, pump it, pump it. And then one more time. Clap. That is a smart wave in Mount Kenya. Ladies and gentlemen, as we usually say, it is best done with music. Mr. Director, give us the music one more time. Is he here or there? DJ Skinner. I've been informed that is the name that is applicable. No, that is not a song. That is not the one. And he's not the one. Is the DJ around? Or he's already gone for lunch? He's gone for lunch. He's going to be back. All right, delegates, we'll revisit this once again. Okay, let's just have our seats until our DJ is going to be ready. Or is he ready? He's not here. Oh my, okay. Let's just have our seats. We'll come back to that, all right? Caleb, we'll come back to your team again. Asante. So we want to go to invite our next speaker. Invite our next speaker, ladies and gentlemen, who is going to give us quite a technical presentation. But one of the things that I like about her, over and above the technical presentation that she's going to give us, I am actually even equally excited to get into a Q&A and appreciate the value proposition that we can get from the questions that we can get from the floor. Ladies and gentlemen, our next speaker is an experienced lady in harnessing the power of data to drive strategic business decisions, and will be taking us through the smart the very able, seasoned icing on the cake and the cherry on top when it comes to the technical conversations. Please help me appreciate the one and only. You know her, you see her, you love her, and you appreciate her. Put your hands together for Barbara Simiwa. She comes forward. Barbara, karibu sana. Welcome. And we are glad to have you here. The most techie person I know at Smart Applications. Welcome, Barbara. Glad to have you. Asante.
Thank you, Ian. Good afternoon, team. I can't believe Ian has called me the most techie person he knows at Smart, while Purity is seated right here. So we'll need to give Purity a chance to speak the techie language so that you can see the difference. So today I'm going to take you through our Smart Business Intelligence Analytics tool. As you've heard, a lot of our previous speakers have touched on it. They've spoken about it. It's a cutting edge tool that is designed to change the way we handle data in our insurance billing system. Thank you, Levi. This product particularly, and I'll just go back to what Isaiah took us through in terms of our journey, our footprint, so that we can appreciate the amount of data and the value that we have in the smart data that we have on board. Our product is built on over 2 decades of experience in the healthcare industry. As Isaiah said, we are celebrating 21 years this year with a presence in over 11 African countries currently, and still growing. So we've been working since 2021. And I say 2021 because Isaiah said that, but even before that, we were working on this product before we released it to the market. So we've been working and we have been leveraging advanced analytics to provide actionable insights that drive better decision-making and improved outcomes for healthcare providers. So today I'm going to walk us through the key features and benefits of smart analytics and demonstrate how it can help you streamline of healthcare services by the population. We finish off with the number of unique patients served, which comes to 55,000, which is a remarkable increase. And you can see the increase there is much more than the increase that we've seen in the other numbers, an increase of 21%. And this growth indicates a broader reach and better healthcare coverage in the region. We'll move on to the next slide, where we look at the cost of healthcare, the cost of access. And here we're looking at the average cost per visit. So the data will showcase, we'll start with the counties, apologies, where we'll look at the top counties in terms of driving business in the region. So we only looked at the top 4 counties in terms of total utilization. So we see Meru County leads with a total utilization of 297 million. The substantial figure compared to what we see for the rest of the counties reflects the county's robust healthcare activities and its vital role in the region's healthcare ecosystem. My colleagues Esther and Isaiah have talked about how we can give you expansion analytics so that we can advise you on where to expand to best. So here we've only focused on counties, but we are able to go as granular as I want to go to Meru. Where is the best place in Meru to open a facility based on different growth indicators that we'll see. We also have Nyeri County coming in second at 195 million. Then we have Laikipia County coming in at 132 million, and Embu County, our hosts, coming in at number 4 with 82 million, which also plays a significant role in the healthcare sector. So of course, by focusing on these key areas, we can identify opportunities for further growth, optimize resource allocation, and enhance healthcare service delivery. We'll move on to the next slide, which I was very excited for and jumped into, where we look at the average cost. So this is the average cost per visit. So in the average cost per visit, we look at the cost of access, and we were able to break it down into the different services that we see our patients accessing. Number 1, we start with the average cost for outpatient services, which as of 2024, as of the end of May, was at 6,000 shillings, showing a slight decrease of 0.32% from what we saw from the same period last year. With the stability that we are seeing, it suggests that outpatient care costs are being managed effectively. And this is a kudos to our healthcare providers. And it means you're also providing affordable access to essential services. We also have dental care costs, which average at 8,000 shillings per visit, with a 4% decrease, bigger decrease than what we've seen in outpatient. The reduction could be attributed to improved efficiencies and better resource management in dental services. Dr. Gaido, big up to you. Then we have yes, I think we should give a clap to Dr. Gaido. Yes. Next, we move to the optical cost, and the optical cost stands at 12,000 shillings, marking a 7% decrease, an even bigger decrease that we saw in outpatient and dental. And the significant drop indicates enhanced accessibility and affordability of optical care in the region. So is it that we've seen a lot of optical centers coming up and therefore having enough resources for the patients to access? We move on to the inpatient services as a general, starting with general inpatient admission, which is averaging at around 84,000, which is an 8% increase. And kindly note here that this is the first service that we've seen having an increase in terms of cost compared to the rest of the specialized ENT services for children. We also see acute bronchitis, which requires effective pediatric care. So a bit of pediatric diagnosis coming in when we are looking at the inpatient side. And this data-driven approach ultimately improves patient outcomes and enhances the efficiency of healthcare services. We'll move on to the next slide, where we look at the commonly administered tests in the region. And in this slide, we present an overview of both the lab tests and radiology procedures. Understanding these tests helps us appreciate the diagnostic landscape and the emphasis on specific healthcare needs. So let's say you're a diagnostic center and you only needed analysis or a market analysis on the diagnostic space. We can be able to only focus on your peers based on the services that you provide. We see that the commonly administered tests in the region highlight the critical role of the diagnostic in healthcare, where we see the full hemogram coming in, the H. pylori, urinalysis, UEC assessment, and stool tests for ova and cysts being essential for routine gastro health. So we see a lot of the lab tests pointing toward patients who are coming in with symptoms that have to do with stomach issues. So again, a lot of incentivizing or also having campaigns around simple things like hand washing that could improve the cases of this diagnosis that we are seeing. In radiology tests, we see including OBS, which correlates to the high maternity rates that we've seen in diagnoses. We also see the pelvic ultrasounds, which are for reproductive and urinary diagnostics. We see the MRI lumbar spine scans for back issues, chest x-rays for respiratory and thoracic conditions, which we've seen prevalent in the diagnosis. So we are seeing the correlation between the diagnosis and the tests that are being carried out. And we are able to see that there's a huge correlation. So we are able to go as granular in our analysis as looking at the treatment types. We're able to look at hypertension, for example, what are the common drugs that are being used in the market, or what are the common treatment types that are being used in the market, so that we can be able to do that market analysis. We'll move on to the next slide, where we look at the most prescribed medications in the region. And in terms of medications, we've been able to break it down into two. Number one, looking at the drug brands, so the names that are being passed by the providers, but through human-supported AI interventions, we've been able to break it down and look at the generic components, because we've had doctors tell us that what you're taught in medical school is the generic components and not the drug brands. So we see the most prescribed medication brands in the region being Augmentin, which is a widely known and used antibiotic and effective against, I believe, bacterial infections. We also see Nexium and Omeprazole, both which are inhibitors, managing gastro issues, acid reflux issues, and ulcers issues. We also see Zinat, which is another effective antibiotic, and also the last medication, which is also an antibiotic. So a big mix of antibiotics and also gastro treating medication. When we see the commonly prescribed medication compositions, not looking at the drug brands, we see paracetamol coming in top, and paracetamol is known for pain relief and fever reduction. And then we see the second composition coming in, which is a composition for Augmentin specifically, an antibiotic for managing bacterial infections. Then we see the Montelukast and Levolucast coming in, which is good for managing asthma and respiratory related issues. So we are able to see through the medications that are being prescribed which specific diseases are being targeted. So these prescribing patterns and what we call prescription data provide valuable insights into the region's healthcare needs and can guide inventory management, procurement strategies, and clinical practices to ensure the availability of essential and widely used drugs. I'll move on to what the future looks like for SMART, and specifically SMART analytics. This will be shaped by several key trends and advancements, some of which are are currently in the works. Number one being the expansion of telehealth and remote patient monitoring, which will rely on analytics to manage vast data collected by remote monitoring tools. The growing importance of natural language processing for extracting insights from unstructured data like doctors' notes or other unstructured data that we see in the healthcare industry. We also have the rise of consumer-driven analytics, empowering patients to monitor their health and make informed decisions. So this is where a patient on Smart Access will be able to see their healthcare trends and be equipped to manage that. We also have improved data sharing for seamless information exchange across systems. So this is where there's transparency and easy sharing across, and more sophisticated predictive analytics. This is where Isaac mentioned we anticipate and prevent health issues based on what we've seen historically. And enhanced decision support systems offering real-time accurate recommendations, and also advance of precision medicine, which tailors treatments based on genetic, environmental, and lifestyle data. So with the more data that we'll be able to collect, enriching the resources that we'll have, we'll be able to go into this very near-looking future. So what is our proposal? And to conclude, let me present what our proposal is specifically for smart analytics, just by giving you a sample of what we are able to give to you, but not limited to that. Number one, we have the live dashboards. So we offer dynamic real-time dashboards that provide real-time insights into your healthcare data. These live dashboards are essential for monitoring key metrics, tracking performance, and making data-driven decisions on the fly. So imagine the numbers that we've shown you today, but on a real-time dashboard. So you're able to see the insights as they come and use that to make data-driven decisions. We are also able to offer static dashboards, or what we call reports. So this is where maybe you need these reports maybe only quarterly or monthly. We can provide this in a static form where you will be able to do the analysis as per your request, print it out and give it to you. We also have training services, and our training services are designed to empower your team with the skills and knowledge needed to leverage data effectively. We offer comprehensive training on various data-related topics, ensuring your staff can utilize smart analytics to its full potential. A note that I've put there, it's important to note that our data scope goes beyond just smart data. So smart analytics is equipped to handle a wide range of healthcare data. So maybe you want us to come in and analyze a 360 view of all your data as a facility. We're able to do that, providing a holistic view that encompasses all aspects of patient care, operational efficiency, and financial performance. So I'd like to close with a very powerful quote shared to me by our COO, Isaiah. The quote is by Peter. And Peter Sondergaard is who we call the father of analytics. He says that data is the oil of the 21st century, but analytics is the combustion engine. So you could have the data, but you're not using it. So it's not really valuable if you're not using it. So this highlights how data analytics transforms raw information into actionable insights, driving decision-making and innovation. At SMART, we are dedicated to revolutionizing healthcare, as Mary has said, with these tools and insights, aiming to improve patient outcomes and drive organizational growth. Thank you for your attention.
Thank you for that, Barbara. And I agree with you and your COO that analytics is the combustion engine. This is the first time I'm hearing that. Been hearing data is the new oil, definitely, but I love what you said about that. And fantastic presentation. I know we'll be able to give you, our next part of the program is where we want to engage with each and every one of you so that we can get into a session of Q&A that will be best driven by one of our directors. But I can see that the DJ is back. Please, delegates, if we can rise one more time, just for 2 minutes. Mr. Caleb, please bring those dancers right here on stage, the best dancers in Mount Kenya region. They are on high demand. They might be doing their tour soon as they go to the other regions, telling the people about the good work that they're doing at Smart Applications. Tupigie Caleb makofi akikuja mbele. Welcome, Caleb. just to make sure that we can be able to stretch it in. Ladies and gentlemen, bear with us. We're almost done with the program. We want to get into a Q&A, and then we can be able to enjoy the lunch and interaction that we are going to have. It would be easier if you can put your seat under the table, and then I want all of us to face
lunch. I am serving lunch, so do not worry. We shall feed you. So we will go through our Q&A session. Anything you want to know from what we've presented today, any question, any further clarity, this is the moment. We don't want to take a lot of time. We had our Menti questions and Menti where you could be able to also drop us questions. We will be answering them even after this day. So yeah, Ian, can I get the questions? If there is any, or clarification.
Chukuntu. Okay, we have one hand here.
Okay.
Let's start with the lady.
Good afternoon, everyone. My name is Aida Mwema. I'm from Alliance Hospital, Garissa. I have a question. Now, from the presentations, we've had like 4 different platforms. My question is, if my facility decides to take all of them, are they going to be 4 different platforms, or is there a way you can link them all into one? Thank you.
Okay. We want to take another question. We will answer them.
There's one here.
Thank you. My name is Moses from Aremi Labs in Embu. My question is on scalability. I run an independent lab. So could we probably have the aspect of negative scalability considered, where I don't need the whole system? I would only need one specifically for the lab. And this may also apply for those running probably dental units as standalone units or any other segments instead of having the whole system. And could this come probably at a cheaper cost, since I am not interested in the whole system?
Okay.
Thank you.
Thank you. Coming to you, Hassan. Let me start here, then I come to you.
Good afternoons. My name is Kim from Jami Hospital. My question is about e-Teams. We are having quite a lot of downtime when we are trying to push these claims to the e-Teams platforms, and customers at times are not able to wait. And I'm seeing that you have a lot of insurance companies partnering with them. If we can find a way, because I'm assuming the problem might be at the KRA. I'm assuming, I don't know, but if you're able to partner with the insurance companies to see how we can upload the claims maybe a bit later, that would be my maybe question or maybe feedback I have. Thank you.
Okay, Hassan. We have one more here.
Okay.
Good afternoon. I have 2 questions. One was asked by my neighbor here about e-Teams. That one I can jump. About the cross-border access. So is this system applicable to only insurance accredited hospital, or it can be installed for any other hospitals operating? Even, for example, we have a cross-border hospital on the other side of Ethiopia. So is this system be limited only to to insurance accredited only?
I am thinking that is a Smart Health, the ERP. Okay. We can answer those questions, then we will take others. So I'll start with the last question. Our Smart Health HMIS is not limited only to insurance patients. It can serve cash, patient, anybody even paying through M-Pesa. So it is not an insurance-based product. It is a product to run a healthcare facility with all those modes of payment. So it can work. It can also work cross-border. So whether you are in Ethiopia, in fact, we are there in the next few days, we shall be in Ethiopia. So we will find a smart team there, and we will be able to set it up. The question on e-Teams, I want our head of products to answer that question. On e-Teams integration with payers, I can always delegate the question.